and let's kick this off with our first question. I'm going to direct the first question to Denise, and then Taya and Mckenzie, you can follow up the answer. But the first question is, does my child actually need Clubfoot?
Oh, thanks, Jeff. And thanks ever so much for asking me to be part of this webinar. It's really good to talk to Clubfoot parents about some of the things that really do bother them. So does every child need physio? Well, I'd say if they have a really well-corrected idiopathic clubfoot, so no other problems, then the most important thing is for their kid to have lots of exercise, do lots of exercise, stay really active, lots of games through play. So formal physiotherapy, not necessarily. There are actually, however, as you know, lots of kids with clubfoot who have other conditions as well. And for them, especially if there's some developmental delay, then physio is going to be really important right from the start. Now, my impression as I see children, I've got over 20 years of experience of using Ponseti method and about 37 years of experience of treating clubfoot, is that as children grow, there are times when they may or may not need some physio input because children change as they grow. So I think it's a case-by-case basis, but the most important thing is exercise, fitness, and general activity for the kids.
That's great. Taya and Mckenzie, do you have any follow-up to that or anything you'd like to add?
No, I mean, I think Denise definitely hit the nail on the head. And I think just allowing a child to do what they're supposed to do, which is play, is the most important thing that you can do to kind of continue to help them grow.
I think that pretty much covers it.
No, it's great. For the next question, I will have Maureen ask it.
Hi, everybody. I'm also going to direct this question to Denise too to start, and then we can have follow up. But I think a lot of parents want to know, is it better or worse to have both feet affected? So is it better if it's unilateral or bilateral?
So again, I think if the correction's really good in the first place, that first correction, and then the boots and bar are worn, it doesn't matter too much. But my general impression is that actually having bilateral clubfoot makes life a little bit easier because you tend to be more symmetrical, and you are, and the kids are then not tending to favor one foot over the other. And so actually, as bizarre as it sounds, it's probably, devastating to have both feet affected when you have a baby. I think it probably is slightly easier in terms of activity, sports, that sort of thing. Although I have to say, I've got grown-up children that I've treated, now grown-ups, who are very, very sporty. They have some asymmetry in their foot size and their calf size, but they're doing completely normal function. And so I usually say to my unilateral clubfoot patients, think about function, not about exactly the way that it's done, because actually, as a parent, you'll always see differences, but those differences might not be important.
Very interesting. What do you think, Taya?
Again, I mean, Denise is on it. I agree with her.
Yeah.
I don't think it's better or worse. I think it's just child specific, and a fully corrected foot is a fully corrected foot, and you'll get the goal that you want later on, which is your child just to be active and to be able to do what everybody else is doing.
Yeah, I agree. Really, if it's corrected, it's corrected. I think it is maybe a little bit easier in my observations for kiddos who've had bilateral because of that symmetry component. But I think, the key is really just making sure that you're seeking treatment early in either situation.
Yeah.
Maureen, I would say that bracing, I think bracing always feels tricky for unilateral parents because they're saying only one foot's affected. Why do I have both feet in the boots? But actually, you're using the good foot to brace the other foot, and it's the best method. We haven't found anything unilateral that really works really effectively. So, I think that's a little bit tricky for unilateral, but it's, and if it's bilateral, obviously you don't think about it.
Yeah, I think that's really interesting from a parent's perspective. My cutie had bilateral clubfoot. And so at first it was like, it was daunting to think that she has 2 feet affected, which means that she has double the chance of relapse or double the chance of issues. But from my experience, even speaking with other parents, the unilateral, there's a typical foot that's constantly being compared to the club foot. And so there is that asymmetry where we don't have that. Like both of her feet are club foot. And so it's, I don't have that direct comparison. So I think it's really interesting that you bring that up. And I do think the bracing point is a good one too, because I think a lot of parents have issues with the non-club foot when they're bracing. And so, yeah, I think it's just interesting that you guys brought that up. So I'll throw it back to Jeff for the next question.
Yeah, next question. This one's for Taya, and then I'll have Mckenzie and Denise with the follow-up. But will this being clubfoot, delay their progress of developmental skills, such as pulling, rolling, crawling, kind of et cetera, et cetera?
So I think, as we as therapists love it when we see a child come early and we meet them early and we get the casting process done as early as possible. And so if you think about it, if the casting process is 4 to 6 to 8 weeks, whatever it takes for your child, if you start that at 1 to 2 months versus later on, the focus of their development is not yet the pulling to stand and the crawling and the true locomotive skills that boots and bars might impact the most in the cast. And so if you start early and then you think about it, and the majority of your time during the day when they're trying to explore their environment and play, they're going to be out of the boots and bars, and they're going to be doing what every other child is doing, and they won't have anything on their legs. And so I guess to really answer the question, no, it shouldn't, as long as you're starting early. But I think the other thing that's beautiful about children is they're going to figure out a way to play. They're going to figure out a way to explore their environment and get what they want to get and do what they want to do. And that's why I love working with kids so much, is that you can't slow down their spunk and their want to play. So it shouldn't. But that's why we want to do it as early as possible, so that they're graduated from the boots and the bars all day long to just at night and nap time when they're just snoozing anyway.
Of course.
Mm-hmm.
Yeah, I think Taya answered that head on. Like, it's just, the earlier you can get the casting process going, the less likely you're going to have the boots and bars on during that time of development when the kids are really wanting to start to kind of do some of those bigger milestones. But again, like, kids are amazing. They figure out how to move and how to do what they want to do. There's going to be that drive there, regardless of whether their embrace is cast or not.
Right.
And so even our friends that come to us who are a little bit older when they start the casting process, really, they often figure out how to move and even how to use their cast and their bars to complete those movement skills.
Yeah.
And then once it's off, like, a lot of them just pick up on everything really, really quickly. So they're very resilient.
Yeah, I would add to that having seen children in a low income setting who have never had treatment, their developmental milestones are normal. They still get up and walk, even on uncorrected club feet, and they still move. And I totally agree with Tia and Mckenzie. Kids are amazing, and they just find ways around doing stuff that we would never imagine. And normally, crawling in the boots and bar is the funniest thing you will ever see. They do this amazing bottom wiggle. It's definitely worth taking video if your child's doing that.
That's great. Yeah, I saw a TikTok video of all things of a kid in a spica cast, real young kid, and just crawling around with the spica cast, doing what kids do, and really wasn't allowing it to stop it from hitting some of those milestones or playing around and playing with their siblings. So it was very supportive of what you're seeing, but kind of what you just said, Denise, it's almost comical to see them adapt to that and move. Maureen, back to you for the next question.
Yeah, I think it was interesting. I wish I had more videos of my cutie actually crawling, but like you guys said, by the time she was really crawling, she wasn't in her boots and bar during the day. It was all just during nap time. I think the one big one that happens when you do the casting process early and you move to boots and bar is the rolling over. And I just was like, how is she going to do this with this like huge device on her feet? But in reality, I think it actually helped her because it helped propel her to like, once she got him up, it was like, okay, then I'm naturally going to go this way. So it's interesting as a parent to watch your kids and your expectation as a parent of what this experience is going to be. And then your kids kind of find their own way through it. I think that's it's a big life lesson for everybody in this developmental milestone question, because we're all asking that as parents. We want our kids to be able to meet these milestones, but it's also, adjusting our expectations of how they get there, right? So I think the next big one that's the next question, and kind of is a follow-up to that, is the biggest question I hear in parents as far as milestone is about walking. So when do you see a child for physical therapy because they're not walking yet? And I'll start with Taya again.
Yeah, that's a good question. So, I think, and I'm sure that you as parents hear that a lot from any medical professionals, that there's so much difference from child to child. And even if you have several children in your own family, there's variability among, when children do whatever. But as a PT, I think that we tend to say that the typical walking age, and I say typical, is anywhere from 12 to 18 months. And so we have some kiddos, obviously, that are outliers. And I would say that you would maybe need to talk to your pediatrician or whomever if your child is not walking by 18 months. And there's nothing else going on to account for that. But again, I think that you just need to remind yourself too, if they're developing and doing all the precursors to walking too, it's okay for some stages to take a little bit longer than others. Especially if it's a third child versus a first child, who may be in the car a little bit more, whatever. You have to think environmentally kind of what their day looks like. But typically speaking, we say at 18 months, if they're not walking, or if you as a mom or dad or grandparent, whomever who just loves this child, if you're concerned, then just ask your pediatrician, and it's always worth getting looked at.
Yeah, I fully agree with that. There is just a large continuum of when kids do start walking, and some are early walkers, some are later walkers. In terms of, things that could be potentially influencing from kiddos that have clubfoot, if you're seeing a little bit of residual decreased range of motion or movement, if we're seeing continued weakness with the foot, those are things that potentially could influence their ability to walk. But again, it's really when we hit closer to that 18-month mark where I would be having concerns if they weren't showing us the precursors around then, or starting to take some steps.
Yeah, I work in a physio-led practice, so I lead a team of 3 other physios in clinic, and I think we're really on it in terms of developmental progress. And I would hope that anybody who's working in a clubfoot clinic would be all over normal development and make sure that every child is you're just checking informally and then formally. So it's I think one of the things I really like about having a very holistic approach to children coming through clinic is you're not just looking at their feet, you're looking at the whole child. And I think I'm biased, but physios do that really well.
I would agree. I think as parents, as clubfoot parents, the walking thing is just such a big deal. And so we're waiting so desperately for those like first few steps, because it's such a huge milestone. Everything that you've kind of worked for within a year has to get them to that point. So I think it's just really good for parents to hear that there's a wide spectrum, right? And every child's different. So, all right, Jeff, you're up.
All right, next question. This question's for Mckenzie to start off with, sort of along the same lines here as the developmental question around walking, but how do I play or interact with my baby? Any games to play with them specifically? Mckenzie, we'll start with you.
Yeah, I mean, you want to play with them like you would with any baby. You're going to hold them, you're going to cuddle them, you're going to treat them like you would a baby that doesn't have club feet and that wasn't going through the casting process. It's important for them to have that same love and interaction. When you do that, you're going to support the cast just because they can be heavy and, put a little bit of extra pull on those hips, but just because they're going through the casting, or even when they transition to the boots and bars, you're still going to do all the same things that you would do. It's important to give them some time on their bellies, just like you would a child that doesn't have a club foot, so that they can kind of start to work on those same strengthening skills and the same, progression of their milestones. I think too, as they transition to being in boots and bars, I really encourage families to do massage to their feet, especially like right after that casting period, slowly starting to introduce different textures to kind of help to desensitize the foot, because after being in cast for a little while, sometimes they can be a little bit sensitive to new experiences. And so that would be, something specific I would do that phase. But otherwise, I would just encourage continued play and interaction like you would anyways.
Of course.
Yeah, and just to add on to that too, I think with any child, just giving them the opportunity to explore their environment, because that's what they want to do. And that's how they're going to learn the transitions and learn the skills. And even if they're learning how to roll with the boots and the bars, like we kind of said, they use them, they use them to help with the momentum and stuff like that. They're still using their truncal muscles and all of the other, kind of forming all those other patterns that we need. And so just letting them be there to protect them, or, be sure it's a safe environment, but just allowing them to be a child and explore their environment and have freedom of movement is so important.
Yeah, that I totally agree. And then as they get bigger, there are some things which are really great. So encouraging them to play in squatting so that you get lots of lovely stretch on the calf complex. Encourage them to stand on one leg. So I'm quite sneaky sometimes when a child's playing standing up against a table. I'll just sneak in behind and lift one leg up so that they're standing on one leg. And, they're quite happy. They'll see that as a sort of fun game. And any sort of balance exercises, hopping, running, climbing, those sort of soft play centers where they do loads of climbing and ball pits and jumping and all those activities. You want a fit, well-balanced, healthy, active child.
Yeah, that's great. Thank you. Maureen, you're up.
All right. We're going to move into a little bit more specific about stretches, right? So physical therapy. So the first question is, and I'll ask Mckenzie, is who teaches the stretches? Is it the ortho? Is it the PT? Is it the CPO? Like, who should the parents be asking about stretches?
Yeah, so I think, any of them can do the stretching education. In our clinic, it typically is the physical therapist who are doing the education on doing stretching. And really, if you have a well-corrected clubfoot and you have a well-fitting brace, that should be incredibly helpful in maintaining the fit position. And stretching, in my opinion, is just really helpful for the families to get a good point of reference for what does the foot feel like now that it's corrected, and kind of be able to follow that along, because as a child goes through growth spurts, they may feel that the foot wants to kind of like tighten just a little bit here or there. And so it's a good way to kind of have a baseline of what does the foot feel like? Should I be concerned about this? Should I reach out to my practitioner? And so I would encourage families to at least have that for an initial baseline.
Yeah. I love that.
And I think too, don't be afraid to ask. No question to us is silly. Our job and the reason why we do what we do is to help the child and to help the family. And so I think one of the best things you could do as a parent is to ask us, am I doing this right? Does this look right? So don't be afraid, and don't think that we're going to be judgmental or anything like that, because we want to see the success too, and we want to support you as parents. So just ask if it looks right and if what you're doing is right. Anybody, whether it's a PT or the physician or whomever, and nobody will frown upon that. And honestly, we applaud you for caring and wanting to do right by your child.
That's a good point.
Yeah, I totally agree with you too. I mean, I don't routinely teach stretches in the initial phases. If we've got a good corrected foot and it's in the foot abduction brace, then I will teach a stretch to get the foot into the brace easily, but I don't add stretches. But obviously, if there's some need to, they need to be taught properly, and parents need to be confident about how they're doing that. And that doesn't matter whether that's the orthopedic surgeon teaching them or whether it's the physio teaching them. It's somebody who understands anatomy and can show them where to put their hands properly and stretch. But there's also, how many toddlers like being stretched? I mean, once you get to toddler stage, you've got to do that stretching actively and through weight bearing activities, because you're not going to, they don't even like their hair brushed. so
I mean, that's true.
Is tricky. So weight bearing stretches are really important, and I'm really keen. That's why squatting, standing on one leg, all of those activities, trike, get them on a trike, those sort of things that are physically going to stretch them in a sort of functional context are really good.
Yeah, I think you guys all made such a good point there, and such different points, but really all in line with kind of how your child develops through clubfoot, right? We know that clubfoot treatment is like during this really crucial early childhood development where your kid grows really quickly, and you're stretching, the physical therapy, what you're doing at home, and your role kind of changes as your child gets older. So I was like, Mckenzie, I always thought of myself as the first line of defense. Like, I had hands on feet every day just so that I had a baseline of what was happening with her feet. And I had my husband do the same, because it was like, then we could compare notes, right? We were like, I tend to be a little bit more anxious than him. So I would be like, I think something's weird on this. And he's like, no, I think it's still the same. But I think it's good just for parents to have that. But then as they grow, that changes. And so your child is growing, in your role and everything, and how you stretch and what you do to encourage that stretching changes with time as well.
That's great. Denise, the next question is for you. I'm going to take a quick pause. We're about 30 minutes in. If anyone does want to ask any chat questions, you're welcome to. If we have time to get to them, we certainly will. But Denise, right along with this stretching, the last stretching question and kind of into this conversation is, how do you know if you're doing stretches correctly? What are you looking for?
So you should have been taught them by your practitioner, whether that's your ortho surgeon, your clinical nurse, your physio, and you should be going through. So I would normally demonstrate the stretch, get the parent to do the stretch, check through that they're happy, and then we always say in our clinic, the parents can send us a picture through WhatsApp. If they're anxious about how they're doing it, they just WhatsApp us so that we can double check that if they're anxious at all, because it is important that if they're going to do stretches, they're going to do them properly, and not. My worry is if they're overstretching in the midfoot, so you're getting a little bit of a rocker in the midfoot, you need to stretch well back on the foot, so you're getting a lovely stretch on the Achilles tendon. So it is important to do them properly, but there's loads of options to make sure that you can monitor that.
I'm sure.
I agree.
Okay.
Great, thanks.
Mckenzie, do you also agree?
I also agree with that. Yes. Yeah. Practice with your therapist, your doctor, whoever is, going over stretches with you. It's the best way. I do the same thing with families as they transition to the boots and bars. And I say, practice taking them on and off with us, because I don't want you to get home and realize that there's something that you didn't feel comfortable with. So same thing with the stretching as well.
And I think, Maureen, you had said earlier, and I tend to be the same way as a mom. I'm always the one who's like overcritical, overthinking. My husband has to talk me down. But I think too, feel free during the first part, if your clinic or physician allows you to take pictures of your hands doing the stretch or a video of you doing the stretch, you can ask them to watch you do it. And so then that way you really have a nice kind of check for yourself later that you can, look on when you're having a moment of panic of like, oh my gosh, this doesn't look right or whatever. But I think that that's a smart thing to do too, just to kind of put your mind at ease.
That is smart.
Yeah, and that not just stretch, but that tickling the outside of the foot to get it to lift up and out is really important as well. So that you do that, we call it the tickle test. So you just tickle the outside of the foot, and it encourages the baby to pull their foot sort of up and out. And that's really nice to teach with the stretches. And yeah, I think filming your PT or your orthopedic surgeon doing that is a really good idea.
I think that's such an important part too, because that's what I was going to suggest, is it's always like take videos if you're able to, because you are going to have moments of chaos at home where you're in the thick of your daily life and you're trying to do the things that you medically need to do. And you're not a medical professional. Most of us aren't, most parents aren't, right? And so we're trying to recall that in the moment. And then the panic of like, am I doing this right? I want to make sure I'm doing it right. Having that video reference that you can quickly look at, I think is just so vital. And frankly, something I didn't do that I wish I would have done, like not just for the stretching, but also donning and doffing the boots and bar. It's all such a huge learning curve for parents, just as it is for your child. And so learning those things and having reference points is just so important for you as a parent to feel like you're going to succeed and confident in what you're doing. So don't be shy. I mean, I think that's part of the reason why I didn't, is I was like, I don't know if I should ask this. Is it okay if I ask these questions? Is it okay if I take a video? So as parents, I just encourage you to like, the professionals are here to help you. Everybody wants your child to get to a good spot. So don't be afraid to ask for the things that you need or extra support as you need it. So
Maureen, as you were given stretches, how long do you think it took before you were like, okay, I feel confident in this? Was it
forever?
Was it ever? Or
I mean, I don't know. I don't want to say, I think it started to become more normal. We started a stretching routine like right after she moved in from cast to boots and bar. And as you know, there was a lot of crying during the initial part. So that once that kind of wore off, and once my baby adjusted, then I felt more confident in what I was doing. So I think it just takes practice like everything else. Well,
it's the learning curve of not just remembering what stretches to do, but then focusing on some milestones on are you doing them correctly and how are you doing them?
Right.
Yeah.
I know. So it can be tricky. And I think the next question kind of plays off of that is, during your child's growth, like how often do you do stretching? Like as they grow, stretching or PT, does the recommendation change based on your baby's age alone?
No, I think it depends on the child and what else they're doing. And so I think it's really good to have a routine when they're in that when they're in the boots and bar phase. Obviously, when they're wearing them 23 hours a day, you've only got that 1 hour when they're coming out. So maybe it's good to do a few stretches before the boots go back on. Or if you're taking a child swimming and they're going to come off then, a few little stretches before you put the boots back on is a great way of doing it. Or at nappy changes. Now, once they're running around, that's the bit, toddlers just don't want to be pinned down. So that's where I prefer to teach some weight-bearing stretches and do sort of active play stretches. But I get your point, Maureen. It's a really good point about having a reference point of how tight your child's foot is. So that could either be by you feeling, or it could be you watching your child going into a squat and realizing when they squat, they have to lift their heels when they go down into a squat rather than keep their feet flat on the floor, which would indicate they're getting a little bit tighter. So it's talking through with your physio the best way for the child, each child really. And the big growth spurts are a time, as they get older, doing some active stretches is a good idea.
What do you think, Taya?
Yeah, I mean, again, Denise, I agree with you. I think it's all just child specific, but I think as long as they're playing and doing all the things they should, that they're, I think that it's fine.
I mean, I've got a little guy that's just gone into the boots this weekend, and he's just on the edge of getting into them. So his mum's doing some lovely stretches. She's taking him out, she's massaging the foot, she's giving him a bit of the stretch, and that helps her get the boots on in a better position. And it's really paying off. So in that situation, I definitely taught those stretches, because that's what's going to get them into the good boot wear and comfort. So that's an example of when I would specifically teach stretches in a young baby.
Yeah.
And I think too, one thing we talk about stretching is to making it part of your daily routine that makes sense for you. I mean, you have to be serious. Like, you're a parent, you can't just stretch all day long, and you shouldn't, because that's taking time away from them for playing, and for you have to give yourself a little bit of grace and mercy as a parent too. It's going to be okay. And so a lot of times in our clinic, we say, like, every diaper change for a young one, if you're in that stage of still needing to stretch, just to kind of keep yourself honest. I mean, I know when I was a new mom, like, I couldn't remember what I was doing at what point in the day. Like, we were just trying to keep everybody well and fed and all that. And so, I can't imagine as a mom also throwing on the boots and bars as well. But again, just give yourself a little bit of grace and mercy, and figure out ways to incorporate it into your daily routine, just to keep yourself honest and something easy to remember. So you're not adding more in, but just making it kind of a part of life.
Mm-hmm. Yeah, that's
good. I'm in agreement with both Denise and Taya with what they've said about this, when to do the stretching, how often to do the stretching. I think one of the things that I often will tell families is that you just don't want to battle each other, because if the child is upset that you're trying to do the stretch, then you're going to feel upset that you're trying to do the stretch. And if you're both battling it out, nobody is going to win in the situation, and you're probably not going to get a great stretch anyways.
You want sneaky stretches.
Right. So you end up doing sneaky stretches. So, like, you might, if you need to keep yourself accountable, then usually what I'll instruct, like Taya said, every daytime diaper change is how often we would recommend that you kind of put your hands on the foot, just to kind of get the child familiar with you touching the foot. So it's a routine type thing, but sometimes diaper changes are not a good time for people. So, if you're snuggling and you just happen to be right there, put your hand on their little foot and just kind of get a feel and sneak it in there, just to hold their foot in the position, just to kind of sneak and feel how flexible that foot is, and get your stretch in. And again, as they get a little bit older and the foot is remaining flexible, you're not feeling a difference at all, which you shouldn't if it's a nice, well-corrected foot. Then you can decrease how often you're doing those stretches. And then as you go back into that growth spurt periods, you might want to put your hands on the foot a little bit more regularly to feel. And if you feel like you're a good person in terms of like being able to visually pick up on the little nuances of how your kiddo is moving in different ways, like lifting their heels up when they're squatting, then great. You might not necessarily be someone who has to feel like they've got to be as hands-on, but if you're maybe more of a tactile person, then make sure that you're putting your hands on the feet and getting a feel of where that foot is.
I think one thing too that Mckenzie said that really spoke to me is if you're battling, nobody's getting anything accomplished. And it honestly, like, as we all know, kids are really smart and they catch on very quickly to what's going on. And so we want it to be a pleasant experience for everybody. And we want to just, like I said, incorporate it into routine. But if you guys are having a rough day, or if they're screaming, or if you're like, you can't do it right now, it is okay. Take a deep breath, walk away, and try it a minute later, because it may just be a time, as we know, when toddlers have just decided they don't want to be touched, and you've got to kind of work with them. And so if everybody's tense and they're crying, then just stop and try it again later, and it's going to be okay.
Yeah.
I totally agree. You've got the boots and bar are the really important stretch thing. They're going on, and they're going on every night, and having that is a big ask for families. And so that's the important focus. And if you're getting your child into boots and bar overnight every night, you are creating a really nice stretch for your child. So beating yourself up about whether you get another 5 or 10 minutes of active stretching. Just don't go there.
Yeah.
If you get it, great. If you don't get it, nobody's going to give you a medal for doing the stretches. If they will give you a medal for the boots and bar.
Yeah. I think that's all such good points. I think as parents, we're trying to be so diligent and do the right thing for our child. And we want to make sure that we're achieving those goals, but all of those points are so great. And I think it is one of those things where there were times where we were really diligent about the stretching, and we found our routine that worked for us. And it also created a routine for our child. So she knew what to expect. Like, okay, before we put on boots, we're always doing stretching. So that worked for us. That worked for her, because then she was like, okay, this is my routine. This is bedtime, right? But there were nights where we were like, everybody's done, she's done, I'm done, and we're just going to put the boots on, and that's going to be the win for today, right? And I think it's okay for parents to hear that message of like, it's okay if the stretches don't happen one day. It's just part of childhood, right? We're all trying to do our best to raise our kids, but we're going to have to be flexible too. So yeah, such good points. All right, Jeff, you're up.
It's my turn. This one's for Taya. So after boots and bars, what PT do you recommend to prevent any more treatment?
I really don't think you need any formal PT. As long as you have a well-corrected, maintained clubfoot, just allow your child to be a child. You guys have been through a lot in 3 to 4 to 5 years, whatever, your clinic and your physician does. And I think as long as they're, keeping up with their peers and doing all the things that you would expect for them to be doing at that age, then well done, you did it. Congratulations. And I don't think that any formal PT is really indicated. Now, if you start to see concerns with like regression or recurrence, or if you're feeling like your child's not keeping up, then just talk to your pediatrician and see. And again, remember, there's huge variability among children. So just allow them the opportunity to play and be a child. And I don't think that formal PT is needed.
I do know there's a question, and I'm not going to read it exactly, but they've got a kid that is a daughter that's 2.5 years old. It's really small, so I'm not going to read it, but they're, doing things like running and climbing and biking. Piggybacking on this question, is there any activity that you would recommend or see specifically? They mentioned roller skating being good for clubfoot. Is there any certain thing that you might recommend? Like, oh, this would be great for a kid.
So again, I think, I've honestly never heard the whole roller skating thing. I would be sure that developmentally that's appropriate for them. I think, at younger ages, I know that, I have a 2-year-old and I wouldn't put her anywhere on wheels just because I don't know, that would make me nervous just in general, but I think any developmentally appropriate thing that your child should be doing, just allow them to do it. Allow them to run, allow them to jump, allow them to explore their environment. And like Denise said earlier, crawl, climb up things, as long as they're being safe, just don't restrict their mobility. And that's how anyone develops, regardless of, if you have clubfoot or not. That's how we all strengthen. That's how we all, form new motor skills. Just give them the opportunity. I don't think that there's any one thing, I think, like Denise said earlier, playing in like a squatted position, if developmentally that's what they're supposed to, but you don't want to ever force something or hold them into a position, because if they're trying to move around, then that's far more important than sticking them into a stationary position just for a stretch or just because it's what's right to do. What's right for the child is allowing them to move and use those muscles and form new patterns and skills.
Yeah, I have to say I love cycling. I love getting kids with Clubfoot cycling, because whether they're unilateral or
Do you
bilateral.
love cycling, or do you like the
I
kids?
love kids. I do like cycling, yeah, but I love kids cycling because it's such a symmetrical sport, and it really works the calf and the ankle. It's low impact. It's so, get your kid on a 3-wheeler trike to start with, however, a balance bike, however you're going to do it. And really encourage that. Swimming, cycling, great activities, because you have to use both legs. You have to be symmetrical. And scooter is great. I'm not sure I'd put a 2.5-year-old in roller skates, because I think they're a bit little for that. But a scooter would be great, but encourage them to use both legs. So swap over which leg they're scooting with and which leg they're standing on the scooter with. So that, again, you're just keeping activity symmetrical. But I totally agree with you. You want a fit, active child that doesn't spend too much time sitting, watching a screen, eating chips.
Yeah, I think the only thing I would add into that is I also like to encourage some play where we're not in shoes, so barefoot play, just to kind of work on some of those smaller, tinier muscles in the foot, and also just give them a chance to work on the whole foot ankle complex without the shoes on. So
yeah, play the tidy up the toys game with bare feet.
Yes.
Pick up the toys to put back in a little pot or a bin with their bare feet. That's a great exercise. Stand on one leg balance, manipulative skills with the feet, and a tidy bedroom. What's not to love?
Yeah.
It's great.
Yeah, I think that's all such good advice for parents. I remember, I'll just speak to from the parent perspective of like, I remember feeling a lot of fear as my daughter started to do new things like gymnastics and like roller skating. She just went roller skating. She's 5. So she went roller skating for the first time and it was awesome. Or skiing, or like anything where I was like, but what if she hurts herself? Like, what if what happens is like she hurts herself and then all this work that we've done, and then she hurts her foot because she's doing a cartwheel for gymnastics or something like that, right? And I remember my physical therapist was like, really pushed back on me for that and was like, but you want her to do everything that she wants to do. That's why you've gotten here. So let her do everything. Don't hold her back from gymnastics because you're afraid she's going to hurt her or injure her foot. Let her do the things that she wants to do. And I think as a parent, sometimes that's hard because you feel like, well, I don't want her to hurt herself. I want this to maintain, but it's also super important for your kids to just be active. I remember being like, there's a lot of running on our couches with my cutie, right? A lot of jumping from the couch to the ottoman to like a lot of just movement that sometimes I'm like, you're driving me crazy, but let's just let them encourage her to do it, because the more active she is, the more she's using her feet. So I think you guys all have made such good points that I hope the parents really like take that in. So the next question is, what are the benefits of physical therapy for those kids whose clubfoot has already begun to relapse or revert? And we'll start with Taya on this one too.
Yeah, so I think that PT would specifically be helpful during the early stages of a clubfoot recurrence for very specific stretching and positioning during play, and then also just for teaching caregivers kind of more pointed things to do, because as we all know, they're different components of a clubfoot, and so sometimes it takes a trained eye to kind of really see what's going on and to monitor that. I think the other part of it too is that it's okay for you just to be the parent. You don't have to be the parent and the doctor and the orthotist. Like, rely on other people for support. And so we can help kind of teach you new ways to do things, because as we all know, as they grow, you have new routines, new likes, new dislikes. And so we can kind of help you incorporate very tailored and specific things for your child into your routine that's going to work for your family. And then also to be a trained eye to see when enough is enough and we really need to kind of get into see the doctor to be sure that there's nothing else that needs to happen. But so I think that it's beneficial again to be a trained eye, to allow you to be the caregiver and not be the advanced practice whomever, and to really kind of help figure out what to do to stop it.
Yeah, such a good point. Do you have anything to add, Mckenzie?
I don't think so. I mean, I think Taya
Mhm.
covered that question beautifully.
Yeah. What about you, Denise?
So I think the classic with a relapse would be they'd come to clinic for a follow-up. And as I say, I mean, the clinic I work in is a physio-led clinic. So they'd typically come into the clinic and we'd see maybe the signs of a very subtle dynamic relapse, which is often, where the foot's just striking the ground slightly differently. And at that point, we'd talk about exercise, stretch, some activities that are going to help. So maybe like using some stretchy elastic band to pull against with the feet. There's a video on YouTube called Strong and Stretchy Feet, and that's really useful for getting kids to do there are some really good activities on that, penguin walking and single leg standing and those sort of exercises. And then we'll get them back 3 months later to see whether the physio has helped or whether that relapse is still progressing. So it's about trying to get those a bit of strengthening and stretch in, but then very important that there's monitoring.
Yeah. Next question for Jeff.
Next question. This should be a fairly quicker answer, but we've alluded to some of this a little bit too, is the barefoot play. But we had a question come in that what specialty footwear might you recommend a child wearing? And we're going to have Mckenzie take this one to begin.
Yeah, I don't necessarily recommend any specific footwear for these kids. I think, like I said before, I think that it's great to make sure that you have time where you're playing barefoot to help with the development of all of the musculature that's kind of been affected during the casting processes. But whatever shoes that you can find that fit comfortably, that are that the kid will keep on, I guess, then go for it.
Hey, any thoughts?
No, I mean, again, I think the boots and the bars are the most important footwear. And so pick your battle to be that, to wear that. And then whatever shoe you want to wear, there's no right or wrong, whatever fits your child.
Yeah, I mean, I'd say you can buy standard off the shelf shoes. There are a few types of shoes I'd say don't get. So I think things like we call them sliders, which are those, or flip-flops that don't have the prong between your toes. What do you call those in the States?
Yeah.
Flip-flops.
Yeah.
Sliders. Okay, so sliders I don't think are good. Things like UGG boots that are very unsupportive, but then most kids don't walk well in them. So you want a good running shoe trainer, a sneaker, brilliant. A good sneaker is just a great shoe, lightweight, not too heavy, or anything else you fancy, but not slip-on shoes in general. I think kids are more supported in either lace up or Velcro or something that really supports the foot nicely, but it doesn't have to be special shoes at all.
Sure.
I think too, I have definitely had parents ask if like high top shoes are better just to support the ankle more, but I think there's something to be said for allowing those muscles to move and allowing those muscles to adapt to the stresses and the strain on the foot, because that's how they're going to get stronger. So if you just quote brace something or try and put a high top shoe on, then you might actually be limiting that typical development of the ankle and the foot that we want. And so again, just give a good supportive shoe that'll allow them to run around and do the things that they want to do.
Yeah,
that's great.
Yeah, I think that's always such a good question. A big thing here in the States is Crocs. So it's like these slide on, almost like plasticky shoes.
Probably the most amazing shoes.
It just
Waterproof.
They're not. That was the only shoe that I remember when I asked this question to our ortho. He was like, yeah, Crocs are the only ones that I'm really like, if you can steer away. It's the same sort of thing, right? Doesn't provide a lot of support, doesn't provide, and you're kind of having to drag the shoe with you, right? It's not giving you that same structure, but I have found that it's just really about what she likes to wear. That's the other piece, like, right? You have to find stuff that your child wants to wear. And they already are different because they have to wear boots and bar at night. And like you said, that's the most important footwear. So it's also kind of meeting them and giving them some freedom and flexibility and choosing their footwear as well, I think is important. The next question is about kinesiotaping. So this will be for Mckenzie. I'll start. Is kinesiotaping a good co-assistant in treatment?
Yeah, so we generally do not do kinesiotaping along with the casting. Casting really is Ponseti casting is really kind of the gold standard for treatment of clubfoot. There are clinics that will do kinesiotaping and French taping for kids that maybe for some reason or other aren't able to go through the full casting processes. But we do the Ponseti casting and don't necessarily do the kinesiotaping. The patients that I have used taping with are typically kids that are not quite ready to start doing Ponseti casting. So I will treat kiddos in the hospital with doing taping techniques, but really this type of taping is geared toward helping them to get some initial stretching, to work more on that sensory component of touch and tolerance of having the foot manipulated, and kind of starting to get us into the process of what it's going to be like doing the clubfoot correction later on. And really, the reason behind that is we're not expecting long-lasting changes with the taping that you're going to see with the casting.
And I think the other thing too is, like, we all know that the Ponseti method is proven to be effective. And so I think that, taping it's not the best option just because you don't want to go through the casting. Because I think that we know that the casting is the gold standard. And if we can just get through that little initial brief time, that's what's going to have the longstanding impact on the foot.
Yeah, you can't manipulate a foot properly using tape. And I'm very old. So when I first started treating clubfoot, I used something called Robert Jones strapping, and manipulation was wrong. Didn't correct the foot because actually it was manipulating the foot in the wrong way. Now, kinesiotaping, you cannot maintain. You have to use plaster of Paris, and that's been really well proven. The only time that I might think about using kinesiotaping is much later on with a very sporty child where there's a very specific problem. But I think once I've used it. I mean, once, and it's so rare, and that's for a very specific sort of. That's more of a sporting problem, an MSK problem, not clubfoot. I don't think there's a place for kinesiotaping in clubfoot. We know Ponseti method works. We know it involves casting, manipulation, casting, tenotomy, foot abduction brace.
Yeah. All right, Jeff, you're up.
I love it. Denise, you're still on. Clubfoot and hypermobility. Any specific patient advice?
Oh, yeah. Well, this is always an interesting one, isn't it? How do you have a tight foot with bendy everything else? I don't understand that pathology. But yeah, there are lots of kids that come into this group. And so the standard treatment is the same. They might correct a little bit quicker because they are so bendy. And then actually, these are the type of kids where you do have to make some modifications depending on what you see with the individual child. So maybe they're going to need the boots and bar set to different angles. Maybe they're going to need a slightly more supportive high top shoe. Maybe they're going to need a little bit of physio input because they may be a bit delayed because of their hypermobility. So this is like a la carte treatment, isn't it? It's very bespoke to the child. And you do see it a lot. One of the classic things is you've got one club foot and then a hypermobile other foot. So that other foot may really overcorrect in the boots and bar. So you may need to set that to an angle less than 40, for example, because it's tending to overcorrect. But I mean, normally I reassure the parents and say, both feet were like the left foot, you'd say they were normal. And if both feet were like the right foot, you'd say they were normal. But in fact, they're both normal, they're just different normal. So, but hypermobility in clubfoot is probably one of the areas where you maybe need to just be a little bit more bespoke in your not in your initial treatment, not in the manipulation, the casting, and the tenotomy, but it might be you're having to be a little bit more bespoke about angles of boots, type of footwear, and input of PT. Yeah,
sure. Interesting. Taya, Mckenzie, do you have any thoughts there?
I don't.
Okay. Mckenzie, anything to add?
No, I mean, I think that they're just if you have a hypermobile foot, it is probably a good time to talk with your practitioner and kind of come up with a game plan on how you would specifically address their needs.
Yeah. Great. Awesome. Great answer, Denise. Maureen, next question.
Yeah, next question is, can I wear my baby / infant toddler in infant carriers? Is that recommended or not recommended?
Yeah, I think it's great. I've done quite a lot of work in Africa, and I've seen babies slung onto their mums' backs and carried literally miles. Like, that's such a comfy position for them. But the front carriers, there's some great front carriers as well. So you want to be looking for a front carrier while they're in cast. You want a front carrier that's really going to support the legs, and you might need to give them a little bit more support sort of underneath the baby's cast just to keep the weight off. But you want a really supportive one. So like the t-shirt ones are good because you can wrap them around, you can modify where you're getting your pressure.
Right.
And as the child gets older, you can definitely use them with the boots and bar. You just have to put the ones that go through the legs are fine, or you have to take the bar off and clip it on once the baby's on. But I think they're a great way of carrying your baby around and giving mum two hands.
What do you think, Taya?
Yeah, I mean, and I think that, carrying your baby, that's just an important thing to do, to have that time with your child too. I think that, like I don't have children with club feet, but I can imagine, and we've seen sometimes that there can be kind of a hands-off fear aspect too, of like, I don't want to hurt them and they can't tell me. And so I think that being in a supportive device will kind of allow you'll know that they're comfortable. And then you're still having that time with them, which is so important early on in infancy. And so I would just say too, if you have friends or anybody who you can try one, then ask them to borrow it for a second, or see if they can come over, or you can go over and snag it for a little bit and just see what works for your child. There are some stores that you might be able to try them on. And so that's another option too, just to see what works for you, because you don't want to be miserable too carrying them around. And so you want something that's comfortable and supportive for you, so you can do the things that you need to do and that you want to do and still have that time with your baby.
Yeah, I think it also helps to address that like comforting piece. I know a lot of parents will give us the feedback that, the day after they get their new cast on, sometimes it's a little bit tougher, we're a little bit fussy. So just like any baby, it's a great way to hold them, snuggle them, add that as like a comfort component. And there's no reason that they're not able to get into those carriers.
Yeah, I think it's just important in the casting phase to make sure you've got one that's really not going to let those casts dangle down free, where they're, so you've got to be able to, you've either got to put support underneath the cast with your hand, or you've got to just make sure the carrier is coming right underneath the knees to support the thigh bits. But it's really possible, and it's a good way to, I work in London where people travel on public transport. It's really useful to be able to use a carrier where you're not having to lift your buggy up and down stairs. So they're a really good thing.
Well, and if you're unsure, bring it to your session, bring it in and try it on with the baby in it during your cast, like after your casting, and have your doctor or your PT look at it and say, hey, does this look okay? We are happy to spend time to take a peek at that kind of stuff.
Yeah, that's what you're there for.
Yeah, I think that's such an important piece, because I think that's why parents are hesitant to doing it because they're like, well, I don't want to do anything that's going to hurt the hips or put extra pressure on the cast or put extra pressure on their knees when they're in the boots and bar. So I think that's such a good opportunity for parents to even send a picture, be like, hey, I have this on. Does this look good? Anything I need to adjust, so that they can feel confident in that. And then I'll also just say, to piggyback on what Taya said, I think it's really important. There's so many carriers out there, right? There's so many different options, and you can spend an ungodly amount of money trying to figure out the carrier that fits best for your child. And maybe your child just doesn't even like the carrier. Like my cutie, I wish she would have liked the carrier. I can't tell you how many carriers I tried. And I kept thinking, well, maybe I'm putting it on wrong. Maybe I'm hurting her. The reality was she just was temperamental and didn't like it. So much to my chagrin. So that's another piece where you have to kind of adjust based on your child's personality. And that's outside of the clubfoot. That's just about babies in general. Some babies are really going to like something and some babies aren't. And so figuring that out and not thinking, oh, well, just because my child has clubfoot, they're not going to be able to do this, but testing it out and not saying, well, the casts are the reason why the carrier didn't work. Sometimes it's just based on your baby's personality, like anything else.
It's awesome. Thanks, Maureen. I'm gonna start to wrap this up. We hit over an hour, which is great. I want to give a huge thank you to Mckenzie, Taya, and Denise. Mckenzie and Taya, they're basically on their lunch break doing this right now. Denise over in the UK, it's what time is it there? 6 o'clock probably.
6 o'clock in the evening. Yeah.
6 o'clock in the evening over there. So huge thank you to you three. Certainly couldn't do this without you, obviously. For the parents out there, I know there were some questions that we didn't get to. We see it, we hear you. My big suggestion is, as we advertise for these events, we ask the question via Instagram. And so if you follow our Instagrams, Mitchell_Ponsetti and Clubfoot Chronicles mom is Maureen's, you'll see occasionally a survey come up and you can ask those questions. We're going to have more of these. And you can DM us, please DM us on what do you want to hear? What events is meaningful, what's impactful, and what can we help you with? So please reach out to us on socials, or obviously, you can email MD Orthopedics, and we've got a great customer service staff to help as well. But those are sort of my last minute thoughts. We've got a survey that'll go out to everyone that registered at the end. We really do read that. We appreciate it. It helps to make these better. This is our second one. I think it was better than our first one, and I think we'll continue to improve. But do you have any last minute thoughts, Maureen?
Yeah, I echo Jeff's. Thank you so much, Denise, Mckenzie, and Taya. This is a topic, like the physical therapy thing is something that I've wanted to talk about a lot because I get so many questions from parents about it. So these resources are really for the parents. So if you want something different, or there's a topic that you want or a question that you want, then really we're here to try to figure out what it is that you guys are looking for so that we can create resources that better support you at home. So please fill out the survey and look for those. I'm always available to answer as best I can questions. I'm just a parent, so I do the best that I can, but it's important for you guys to give us feedback. And I'm really appreciative that you guys took the time today to be here, Denise, Mckenzie, and Taya. It was so vital. And so many of the things that you said are so important. And I think it really is going to be beneficial to so many parents out there. So thank you so much for being willing to do this.